Hi, this is Dr. Portia Jackson Preston. I am a public health researcher who focuses on self care, and I want to do what I can to try to educate people who want to know more about the coronavirus. And I want to speak specifically to parents. Myself, not being a parent, I have asked a good friend of mine who is both a parent and a medical doctor to address some concerns that people have. So I'm going to patch her in over audio right now. Hello.
Hi.
Do you want to go ahead and introduce yourself?
Yeah, my name is Heather Readhead. I'm a primary care and urgent care physician. I also have a lot of public health experience. I used to work for LA County Department of Public Health. But at the moment, I'm just on the front line seeing sick patients and being a mom.
So those are the two things that I want to talk to you today about. So first, I think we're going to ask for you as a medical doctor who's also a mom, what are, if you were to say the top three things, what should parents and caregivers know to protect both themselves and their kids right now?
I think the first thing is just really to take this seriously, to recognize that this virus is not going anywhere. It's all around us in our communities, and it can be unpredictable as to who gets really ill, and that our health system will be overwhelmed by this. Something very raw to think about, like we only have a certain number of ventilators, we only have a certain number of people we can take care of in a critical care way. And so the main thing that we need to be focused on right now is trying to prevent the spread of virus, slow it down so that when people do get really ill, and they will, we at least can give them a fighting chance. We at least give them the chance to have access to an ICU unit or a respirator if they need it. And then hopefully eventually potentially drugs to treat this virus.
Okay, thank you so much. Now, we talked about a concept before we got on the call earlier about flattening the curve. For anyone who hasn't heard of that concept, can you explain what that means?
Yeah, it basically means that we are going to have epidemiologic spread, which is explosive spread throughout the population because it's a novel virus. Nobody has immunity to it, and we don't have a vaccination. So it will spread throughout the community. And we think that at least, 50% of people will have to be infected before we have herd immunity, which will slow that transmission down, or before we have a vaccine. And so, but recognizing that epidemiologic curve, that spread of disease can be very fast spread, or if we separate ourselves and we don't shake hands and we don't go to school and we don't go to work and we don't have play dates, we can actually slow that spread over many months, ideally spread out over a year or 18 months and or more. And that way we can reserve our healthcare capacity because we just have fewer people sick at any one time. And we also give ourselves a chance to develop medications to treat this and to develop a vaccine in the interim. So we're just slowing down the spread.
Okay, thank you so much for that. So I want to go back to one thing that you talked about, play dates. Been talking to a lot of parents all day today. Some have babies, some have toddlers, some have teenagers. So how do we deal with this idea of children being around other children or adolescents being around other teenagers? How should we be approaching things like play dates right now?
Yeah, I think unfortunately these are unusual times. A pandemic doesn't come along. The last one we had was probably our 1918 to 22 Spanish flu, so 100 years ago. And, unfortunately, the only way to stop spread is by not having contact with other people, staying 6 feet or more, and that really prohibits all kinds of social interaction in person. Again, that means not going to school, not going to daycare, not going to work, or working remotely, and doing school remotely. And it does mean not having play dates. It really means that people need to stay indoors and children need to be at home as much as possible.
So to be clear, we know that not everybody can avoid their work site, you being one of them, because you have to go in, you have to treat patients. So for people that need to do some type of work, we definitely have the social distancing. We're asking them to stay 6 feet apart. And you were explaining to me earlier a precaution that people might want to take if they have a chronically ill relative at home or somebody who's at risk. What might they want to do when they come home before they interact with that person?
Yeah, so the recommendation is that you not only you wash your hands or Purell your hands, sanitize them as you come in the door before you touch anything, but that you also do that with your cell phone or any electronic or hard surfaces that you have taken out with you, that you actually take off your shoes. So you have a dedicated pair of shoes to the outside world, and you actually do not bring in those shoes to the household. You take off all your clothes. You put them in a dedicated laundry bin, just like your dirty wash. Do not rewear clothes you've been in the outside world, and that you actually take a shower and wash your hair. So for healthcare workers, I'm a mom of 2 4-year-olds. I do not wash my hair every day normally. And so this is a new practice for me, and it's really hard to do. But when I am in the outside world, whether that's going to the grocery store or going to work, I do have to, try to maintain this kind of rigor, not to bring the virus into our homes, because it lives on our clothes, it lives on our hair, it lives on the hard objects. And it's also me trying to actually not take a purse with me to work, but to just put things in a pocket, wear a jacket that I can also wash, put in the wash. Just really being thoughtful about what objects we take out of our house, exposed to the virus, and then bring back home with us.
Wow. Well, thank you. That's really informative. And I'd like to ask you 2 closing questions. The first one is, how are you talking to your sons? They're 4 years old. So what are you telling them about this?
Yeah, I'm trying not to be too scary about it, but at the same time, I have been honest with them. They're almost 5, but I've been talking about that there's, this virus, this illness. We need to wash our hands. This is why we just literally on Friday, stopped going to school. And why mommy can't touch mommy until mommy has taken off all her clothes and done her shower. But I'm really trying to be honest about, why we're doing this. And it's hard, they don't want to wash their hands before they eat, and again after they eat. They don't know why I'm freaking out, and I'm trying to maintain calm, and I'm trying to just explain it and say, well, the viral particles are here. We have to make sure we wash our hands. If that falls on the floor, we can't do it. A lot of it is normal hygiene that we would do anyway. But it's obviously, stepped up a notch.
Mm-hmm.
And but I am trying to be honest about it and break it down and talk to them about it. And I've showed them pictures of what viruses look like, so they have a visual in their mind of these little balls, with the little spikes coming out. And they even drew a picture a few days ago. So it's definitely sticking. They're thinking about it.
That's fantastic. And so I want to thank you so much. I know that everyone who's watching this has hard choices to make. And I want to be very clear that when I'm talking to people, it's very much an honor to talk to somebody who's a healthcare professional, but she's also making personal decisions for herself as a mother. So I just want to remind people that you might have different thoughts and opinions, but it's really important to think through what's best for you and your family. So the last thing I want to ask you before we close this is, how are you caring for yourself during this time? This is a lot of anxiety for you as a mom, as a healthcare professional.
Yeah, I think the first thing, to be honest, is that my husband and I, we don't do a lot of screen time with the kids. And the first thing that has changed is we have said, look, we need a time that we can actually talk and plan for childcare, plan for time to do self-care, and plan for sleep and uninterrupted sleep and things like that. And we put on videos so the kids can be watching a video, and we can sit down and actually have a conversation and write down a plan.
Mm-hmm.
And as best we can, to do a little bit of carve out. My husband likes to do meditation and yoga, and even if it's 10 minutes a day,
Mm-hmm.
he really needs to have that time to do it.
Mm-hmm.
For me, self-care can actually be a long hot shower without an interruption. Or being able to have a cup of tea in quiet. So it doesn't have to be dramatic or lengthy self-care,
Right.
but it still is important to carve that out.
Mm-hmm.
And then also we made a plan of how to switch off on bedtime routines and stuff like that, just to give each other a break.
Oh, those are fantastic tips. I want to thank you so much for taking the time to do this. And I hope that a lot of people will be able to watch this and have just a little bit of reassurance, because this is new, it's unfolding every day. And I think whatever we can do to help support each other as we try to make these decisions is really helpful. So thank you for your time.
No, thank you for having the webinar. It's really helpful.
Okay, thanks.
Bye-bye.